right here with Pharm Talk tonight. We'll be discussing ACE inhibitors based on their mechanism of action, why they are used, and are they really the answers to controlling cardiovascular diseases?
Cardiovascular conditions such as hypertension, heart attack, and heart failure, and diabetic neuropathy are medical conditions that affect a significant proportion of our global population. Angiotensin converting enzyme inhibitor is a pharmaceutical drug that is most commonly used to lower blood pressure. Research has also stated that 34% of those experiencing cardiovascular disease were using ACE inhibitors.
Let's now look at how ACE plays a role in our body system. The RAS is a homosystem that is responsible for the regulation of arterial blood pressure, renal hemodynamics, as well as fluid and electrolyte balance in the human body. The abnormal function of the system plays a key role in the pathogenesis of such cardiovascular and kidney conditions. So let's take a look at what happens in the system so that we can better understand how ACE inhibitors work. Step 1 of the system involves the juxtaglomerular cells in the kidneys generating prorenin and releases renin when blood volume is low into the body system. Followed by step 2, where angiotensin is converted to angiotensin 1 with the help of plasminorenin. The angiotensin 1 is transformed to angiotensin 2 with the help of angiotensin converting enzyme, which is located in the lungs. Angiotensin 2 has the ability to constrict blood vessels. These cause an increase in blood pressure. It also activates the secretion of the hormone aldosterone from the adrenal cortex. Another effect of the RAS is the increase in blood pressure because aldosterone causes tubules in the kidneys to absorb more water and sodium, thus an increase in fluid in the body. Angiotensin 2's main job is to constrict blood vessels in the body. This can be annoying for some individuals because it causes high blood pressure and causes the heart to work much harder to allow a sufficient amount of blood into the body system. ACE has two main roles in the body, which I will now explain. ACE is responsible for the breakdown of bradykinin, which is known as a vasodilator, and other various peptides. ACE's primary action is to catalyze the conversion of angiotensin 1 to angiotensin 2. ACE is made from the endothelium cells of the kidneys and the lungs. It consists of two main isomers, which are somatic and germinal. The somatic gene is predominantly present in the lungs, vascular endothelium cells, epithelial kidney cells, testicular lymphatic cells, and various other tissues in the human body, while the germinal gene is mainly present in the sperm. The main function of ACE inhibitors is to completely inhibit the actions of ACE-ACE1 receptor in the RAS, and therefore preventing the conversion of angiotensin 1 to angiotensin 2, as well as the breakdown of bradykinin. The most frequently prescribed ACE inhibitors include peridopril, captopril, enalapril, lisinopril, and ramipril. There are numerous ACE inhibitors, however, three distinct groups are sulfur-hydryl-containing agents such as captopril in the UK, phosphoric acid derivatives, for example, lisinopril, and non-sulfur-hydryl-containing agents. Captopril and phosphorophil bind to the zinc ion in ACE molecules via the sulfur-hydryl and phosphoric acid bonds. Other drugs bind to the zinc ion on ACE via the carboxyl residues. ACE is hydrolyzed by gastrointestinal mucosa and hepatic esterases.
So, how do ACE inhibitors work? Well, ACE inhibitors were initially approved for the treatment of hypertension, that is, high blood pressure. As mentioned, the inhibition of ACE prevents the conversion of angiotensin 1 to angiotensin 2, and thus blood vessels cannot be constricted. The increased diameter of these blood vessels thereby lowers arteriolar resistance and increases venous capacity. Also, by preventing ACE from breaking down bradykinin, these blood vessels can remain dilated. ACE inhibitors can be used alone or in combination with other antihypertensive medications. ACE inhibitors have also been found quite useful in the treatment of acute myocardial infarction, cardiac failure, diabetic nephropathy, and even antisocial behavior disorders. In the event of a heart attack or cardiac failure, ACE inhibitors are used to decrease cardiac output and increase the ejection fraction of the heart. Studies have shown that a single dose of captopril results in a 40% reduction in the filling pressure of the left and right heart. With renal complications caused by diabetes, ACE inhibitors decrease renal vascular resistance and results in increased blood flow to the kidney. Also, the increase in bradykinin has been associated with contributing to the slow progression of diabetic nephropathy. So there you have it. ACE inhibitors are pharmaceutical drugs that are particularly effective at treating hypertension and can assist in the treatment of a small number of other medical conditions. However, patients do need to be assessed prior to taking ACE inhibitors to ensure that they are not contraindicated against taking the drug, and also need to be monitored whilst taking it to ensure that any adverse side effects that arise are controlled. If you wish, you can find further information regarding ACE inhibitors from these sources here.